Let's practice 100 plus hospital sentences. Arriving at the hospital and registration.
Good morning. How may I help you today?
I'd like to see a doctor. I've been feeling unwell for the past few days.
I'm sorry to hear that. Are you a new patient or have you visited us before?
This is my first visit.
No problem. I'll help you with the registration process.
Thank you.
May I have your full name, please?
Eliana Carter.
And your date of birth?
September 12th, 1995.
Thank you. Could you also provide your phone number?
Certainly. It's 555-248-7812.
Great. What's your current address?
18 Maple Street, Chicago.
Thank you. Who should we contact in case of an emergency?
My husband, Daniel Carter.
May I have his contact number as well?
Yes, it's 555-248-7899.
Perfect. Do you have any health insurance?
Yes, I do.
Could I please see your insurance card?
Of course. Here it is.
Thank you. Let me verify your coverage.
Sure.
Your insurance is valid and covers general consultations.
That's good to know.
Have you visited any other hospital regarding this issue?
No, this is the first time I've sought medical help.
All right. Could you briefly tell me what's been bothering you?
I've had a fever, headache, and body aches for several days.
Have you experienced any coughing or difficulty breathing?
No, nothing like that.
Understood.
Will I be able to see a doctor soon?
Yes, the current waiting time is approximately 20 minutes.
That's reasonable.
While you wait, please complete this medical history form.
Okay. What information do you need?
Previous illnesses, allergies, medications, and any surgeries you've had.
All right, I'll fill it out.
If you need any assistance, please let me know.
Thank you.
I see you've mentioned a penicillin allergy. Thank you for noting that. It's important information for the doctor.
I always make sure to mention it. Is there anything else I need to do?
No. Please have a seat in the waiting area.
All right.
The nurse will call your name shortly.
Thank you for your help.
You're welcome. I hope you feel better soon.
Nurse assessment and medical history.
Eliana Carter? Eliana Carter?
Yes, that's me. I was asked to wait in the reception area until someone called my name.
Hello, Eliana. My name is Ethan, and I'm one of the nurses here. I'll be conducting your initial assessment before you meet with the doctor.
Nice to meet you, Ethan. Thank you for helping me today.
You're very welcome. Please come with me to the examination room so we can begin.
Certainly. I'll follow you.
We'll do some preliminary checks and gather information about your symptoms before the doctor sees you.
That sounds good. I'm happy to provide any information that might be helpful.
Please have a seat and make yourself comfortable.
Thank you. I appreciate it.
I understand you've been experiencing a fever and headaches recently. Is that correct?
Yes, that's correct. Those have been my main symptoms over the last few days.
How long have you been feeling unwell?
It's been about 4 days now, and I haven't noticed much improvement.
Have your symptoms been getting better, getting worse, or staying about the same?
I would say they've stayed about the same. Some moments are better than others, but overall, I still feel sick.
Thank you for explaining that. Consistent symptoms over several days can provide useful information for the doctor.
The fever seems to come and go throughout the day, which has been frustrating.
What's the highest temperature you've recorded at home?
The highest reading I got was around 101 degrees Fahrenheit.
Have you taken any medication to reduce the fever or relieve the headaches?
Yes, I've taken some over-the-counter pain relievers, mainly to help with the fever and body aches.
Did those medications provide any noticeable relief?
They helped for a few hours, but the symptoms usually returned once the medication wore off.
I understand. Temporary relief is common. but it's important for us to determine the underlying cause. Let's begin by checking your temperature so we can compare it with the readings you've taken at home.
Of course. Let me know what I need to do.
Please place this thermometer under your tongue and keep your mouth closed for a few seconds.
No problem. I'll do that now.
Thank you. Your temperature is slightly elevated, which confirms that you're still running a mild fever.
That doesn't surprise me. I felt warm and uncomfortable most of the day.
Next, I'd like to check your blood pressure to make sure everything looks normal.
All right. Go ahead whenever you're ready.
Please relax your arm and rest it comfortably on the table.
Like this? I want to make sure I'm positioned correctly.
Yes, that's exactly right. Keeping your arm relaxed helps us get an accurate reading. Your blood pressure is within the normal range, which is reassuring.
I'm glad to hear that. At least that's one less thing to worry about.
Now I'll check your pulse and heart rate.
Certainly. Please go ahead.
Your heart rate is slightly higher than average, but that's not unusual when someone has a fever.
That's good to know. I was wondering if that might be related to how I've been feeling.
Are you experiencing any dizziness or lightheadedness?
Occasionally. It usually happens when I stand up too quickly or move around a lot.
Thank you for mentioning that. What about nausea or an upset stomach?
Fortunately, I haven't experienced any nausea so far.
Have you had any coughing recently?
Just a little bit, but it's not constant.
Would you describe it as a dry cough, or are you coughing up mucus?
It's mostly a dry cough without any mucus.
Have you noticed a sore throat?
Yes, especially in the mornings when I first wake up.
Have you experienced any difficulty swallowing food or drinks?
No, swallowing hasn't been a problem for me.
Have you felt any chest pain or pressure?
No, I haven't experienced anything like that.
What about shortness of breath during normal activities?
No, my breathing feels normal, even when I'm walking around.
That's reassuring information and something the doctor will be pleased to hear.
Have you experienced fatigue or unusual tiredness?
Absolutely. I've been feeling exhausted, even after resting for several hours.
Has that fatigue affected your daily routine or work responsibilities?
Yes, it definitely has. I've had trouble concentrating and staying productive at work.
What kind of work do you do?
I'm a marketing manager for a large company, so my job can be quite demanding.
That sounds like a position with a lot of responsibility and pressure.
It certainly can be, especially when we're working on major projects or deadlines.
How many hours do you typically work in a week?
Usually around 50 hours, and sometimes even more during busy periods.
That's quite a heavy workload and could contribute to stress and fatigue.
I agree. Lately, I've been feeling more stressed than usual.
How has your sleep been over the past few weeks?
Honestly, it hasn't been very good. I've struggled to get enough rest.
Approximately how many hours of sleep are you getting each night?
Most nights, I only get about 5 or 6 hours of sleep.
Ideally, adults should aim for 7 to 9 hours of quality sleep each night.
I know that's recommended, but it's been difficult to achieve with my schedule.
Have you been dealing with any unusual stress recently?
Yes, work has been particularly busy, and I've been managing several important projects at once.
Stress can sometimes weaken the immune system and make it harder for the body to recover from illness.
That makes a lot of sense and could explain why I've been feeling run down lately.
Let's talk a little about your medical history so we can give the doctor a complete picture.
Of course, I'll answer as accurately as I can.
Do you have any chronic medical conditions that you're aware of?
No, I've generally been healthy and haven't been diagnosed with any chronic illnesses.
Have you ever been diagnosed with high blood pressure?
No, my blood pressure has always been normal during routine checkups.
What about diabetes or blood sugar issues?
No, I've never had any problems related to diabetes.
Have you ever been diagnosed with asthma or any other respiratory condition?
No, I've never had asthma or any significant breathing problems.
Have you ever been hospitalized for any reason?
Only once, and that was for a relatively minor surgery.
What type of surgery did you have?
I had an appendectomy after my appendix became inflamed.
How long ago was that procedure?
It was about 10 years ago when I was still in college.
Are you currently taking any prescription medications?
No, I'm not taking any prescription medications at the moment.
Do you take any vitamins, supplements, or herbal products regularly?
I take a daily multivitamin, but that's about it.
Do you have any allergies that we should be aware of?
Yes, I'm allergic to penicillin.
Could you describe the reaction you usually have?
I develop a noticeable rash shortly after taking it.
Thank you for mentioning that. It's very important information for your medical record.
I always make sure healthcare providers know about that allergy.
How would you describe your diet?
I try to eat healthy meals, although I do eat at restaurants more often than I'd like because of work.
Do you exercise on a regular basis?
I try to go for walks several times a week, but I know I could be more consistent.
Regular walking is still a healthy habit and a good form of exercise.
I appreciate that. I'm hoping to become more active once I'm feeling better.
Every bit of physical activity contributes to better overall health. Have you traveled anywhere recently?
Yes, I returned from a business trip last week.
Where did you travel during that trip?
I traveled to London for a series of meetings and presentations.
Did your symptoms begin before you traveled or after you returned home?
They started a few days after I came back from the trip.
That's important information because recent travel can sometimes help explain certain symptoms.
Should I be worried that it's something serious?
At this stage, it's too early to draw any conclusions. The doctor will review all of this information carefully before making an assessment.
That makes me feel a little better. Thank you for explaining it.
You're welcome. I've now completed your assessment and recorded all the information you've provided.
That's great. I hope it helps the doctor understand what's going on.
It certainly will. The doctor will review your chart and see you shortly.
Thank you very much for your help and for taking the time to explain everything.
You're very welcome. We want to make sure you feel informed and comfortable throughout your visit.
Everyone I've spoken to today has been very kind and professional.
We're glad to hear that. Our goal is to provide the best care possible and make every patient feel supported.
I really appreciate that.
The doctor should be with you soon. In the meantime, please relax and let us know if your symptoms change or if you need anything.
I will. Thank you again for all your help today.
It's my pleasure. I hope you're feeling much better very soon.
Doctor consultation.
Good afternoon, Eliana. I'm Dr. Ethan. I've reviewed the notes from the nurse, and I'd like to discuss your symptoms in more detail so we can understand what's causing them and determine the best course of treatment.
Good afternoon, doctor. Thank you for seeing me today. I've been feeling unwell for several days, and I'm honestly a little concerned because the symptoms don't seem to be improving as quickly as I expected.
I'm glad you came in. Many conditions can cause symptoms like headaches and fatigue, and it's important to gather as much information as possible before reaching any conclusions. Now, let's start with how you're feeling today compared to when the symptoms first appeared.
The headache has improved slightly since this morning, but I'm still feeling extremely tired. Even simple daily activities seem to require much more effort than usual. Normally, I'm very active and productive, but lately, I've been struggling to keep up with my regular routine.
I understand. Fatigue can affect many aspects of daily life, including concentration, productivity, and overall well-being. On a scale of 1 to 10, how would you rate your headache right now? And how severe was it at its worst?
Right now, I'd rate it around a 4, but at its worst, it was probably an 8. It became so intense that I found it difficult to concentrate on my work, and I even had trouble participating in meetings because I couldn't focus properly.
That sounds quite uncomfortable. Have you noticed any pattern? For example, does the headache occur at a particular time of day, or are there specific activities that make it better or worse?
I've noticed that it usually becomes worse during the afternoon and evening. Rest and pain medication help a little, but spending long hours in front of a computer screen seems to make it much worse. Bright lights also seem to bother me more than usual.
That's helpful information. Have you experienced any sensitivity to noise, dizziness, blurred vision, or nausea along with the headaches?
I haven't experienced blurred vision or nausea, but I have felt slightly dizzy a few times, especially when standing up quickly. I've also noticed that loud environments feel more irritating than they normally would.
That's helpful information. Thank you for mentioning that. I'd also like to understand the fatigue you've been experiencing. Is it mainly physical exhaustion, mental exhaustion, or a combination of both?
It's definitely a combination of both. Even after sleeping through the night, I wake up feeling drained, and I've noticed that my ability to focus and stay productive has decreased significantly. By the middle of the day, I often feel like I need another few hours of sleep.
Has this affected your work schedule or daily responsibilities?
Yes, it has. Yesterday, I worked from home because I didn't feel well enough to go into the office, and even then, it was difficult to stay focused for long periods. Tasks that would normally take me 30 minutes ended up taking much longer because I kept losing concentration.
Have your colleagues or family members noticed any changes in your energy levels or behavior?
Yes, actually. A few coworkers commented that I seemed unusually tired during meetings, and my sister mentioned that I looked exhausted when she saw me over the weekend.
Sometimes people around us notice changes before we fully recognize them ourselves. When did you first begin experiencing these symptoms?
The fatigue started about a week ago, but it was fairly mild at first. The headaches began a few days later and gradually became more noticeable.
Did anything significant happen around that time? For example, increased stress at work, travel, changes in your routine, or exposure to someone who was sick?
I recently returned from a business trip to London. It was a very demanding trip with a packed schedule, and I didn't get much sleep while I was there.
Tell me more about that trip. How long were you away, and what was your schedule like?
I was there for 5 days. Most days started early in the morning and ended late in the evening. We had meetings, presentations, and networking events almost every day.
Approximately how many hours of sleep were you getting each night?
Probably 4 or 5 hours at most. I kept telling myself I'd catch up on sleep later, but that never really happened.
Sleep deprivation can have a significant impact on the body. It can weaken the immune system, increase stress levels, and contribute to headaches, fatigue, and difficulty concentrating.
That makes sense. I knew I was tired during the trip, but I didn't realize the effects could continue after I returned home.
They certainly can. Sometimes the body doesn't show signs of strain until after a stressful period has ended. Once things slow down, symptoms become more noticeable.
That's exactly what happened. I felt relatively fine while I was traveling, but once I got home, everything seemed to catch up with me.
Let's talk about your eating habits. Have you noticed any changes in your appetite recently?
Yes, I've been eating less than usual. I don't feel particularly hungry, and sometimes I skip meals because I'm either busy or too tired to prepare anything.
Have you experienced any weight loss as a result?
Nothing dramatic, but I think I've lost a couple of pounds over the past week or two.
Any stomach pain, nausea, or digestive issues?
No, I haven't noticed any problems like that.
That's good to know. How about hydration? How much water would you say you drink during a typical day?
Honestly, probably not enough. On busy days, I might only drink 3 or 4 glasses of water.
I'd like to see that number much higher. Dehydration is a common cause of headaches, fatigue, and dizziness, especially when combined with stress and lack of sleep.
I can definitely improve in that area. I often get so focused on work that I forget to drink water regularly.
That's very common among busy professionals. Now, let's discuss stress. How would you rate your current stress level on a scale from 1 to 10?
I'd say it's around an 8. The last few months have been particularly demanding.
What's contributing most to that stress?
A combination of deadlines, client presentations, managing my team, and trying to balance everything at once. It often feels like there's always another urgent task waiting for me.
Do you find it difficult to disconnect from work when you're at home? Chronic stress can have a significant impact on both physical and mental health. Over time, it can contribute to fatigue, headaches, sleep disturbances, and a weakened immune response.
Hearing that makes me realize I probably haven't been taking care of myself as well as I should.
Many people don't realize how much stress affects their health until symptoms begin to appear. The important thing is that you're addressing it now.
I appreciate that perspective. It's reassuring to know there may be an explanation for what I've been experiencing.
Absolutely. Based on everything you've told me so far, several factors could be contributing to your symptoms, including lack of sleep, dehydration, stress, and possibly a mild infection.
Do you think it's anything serious?
At this stage, nothing you've described immediately suggests a serious condition, which is encouraging. However, I prefer to confirm that with appropriate testing rather than making assumptions.
I completely understand. I'd rather know for sure than continue guessing.
That's the right approach. I'd like to get some blood tests and routine laboratory work. These tests will help us identify any signs of infection, nutritional deficiencies, or other underlying issues that might be contributing to your symptoms.
How long will it take to get the results?
The tests themselves will only take a few minutes, and we should have most of the results later today. Once we review them, we'll have a much clearer picture of what's going on.
That sounds reasonable. I'm glad we're taking a thorough approach.
In the meantime, I'd like you to focus on rest, hydration, and reducing unnecessary stress whenever possible. Your body needs time to recover.
I'll make that a priority. I think I've been pushing myself too hard lately.
Your health has to come first. Work is important, but recovery is equally important when your body is telling you something isn't right.
You're absolutely right. I needed that reminder.
Before we proceed with the tests, do you have any questions or concerns you'd like to discuss?
Just one. Assuming this is related to stress, exhaustion, or a mild infection, how soon do you think I'll start feeling like myself again?
If our initial assessment is correct and you follow the treatment recommendations, you should begin noticing improvement within a few days. Full recovery may take a little longer, especially if your body has been under significant stress for an extended period.
That's reassuring to hear. I was worried this might continue for weeks.
I understand your concern. The good news is that you've sought medical attention early, which gives us the best opportunity to address the problem before it becomes more serious.
Thank you for taking the time to explain everything so clearly. It's helped me feel much less anxious about the situation.
You're very welcome. Let's get those tests completed, and once the results are available, we'll discuss the next steps together and make sure you're on the path to recovery.
I appreciate your help, Doctor. I'm ready to proceed with the tests.
Excellent. The laboratory is just down the hall. We'll have more answers soon and work together to get you feeling better as quickly as possible.
Laboratory tests and results.
Hello, Eliana. I'm Ethan from the laboratory department.
Hello.
Dr. Williams has requested a few tests for you.
Yes, he mentioned that.
Don't worry. Most of the tests are routine and should only take a few minutes.
That's good to hear.
The doctor has requested a complete blood count
an infection screening panel, and a few additional tests.
What will those tests show?
They'll help us determine whether your symptoms are being caused by an infection, inflammation, or another underlying issue.
I see.
Take a deep breath.
Okay.
And we're done. That was quick, wasn't it?
Much quicker than I expected.
I'll place a bandage on your arm.
Thank you.
Please keep pressure on the area for a minute or two.
Will do.
Have you had anything to eat today?
Just breakfast.
Good. That should help prevent any dizziness.
I feel fine.
Excellent.
How long will it take to get the results?
Most of the results should be available within 2 hours. You can wait in the patient lounge while we process everything.
All right.
There are refreshments and comfortable seating available.
Thank you.
The doctor has received your test results and would like to see you again.
Great. I've been curious to know what they found.
Please follow me. I have your test results.
Is everything okay?
Overall, yes.
That's a relief.
Let's go through the results together. Your blood pressure, heart function, and oxygen levels all look normal.
That's good news.
Your blood work shows signs of a mild infection.
So there is an infection?
Yes, but it's relatively minor.
Do you know what's causing it?
Based on your symptoms and the test results, it appears to be a throat and upper respiratory infection.
Is it bacterial or viral?
At this point, it appears more likely to be bacterial.
Is that serious?
Not in your case.
That's good to hear.
We caught it early, which is always beneficial.
What about the fatigue?
The infection is contributing to it, but I believe stress and lack of sleep are also major factors.
That doesn't surprise me.
Your body has been working hard.
I guess I've been pushing myself too much.
That's often the case with busy professionals.
You're probably right.
The good news is that I don't see any signs of a serious illness. However, your body is clearly asking for rest.
Message received.
I'd strongly recommend taking a few days off work if possible.
I think I can arrange that.
Good.
What treatment do I need?
I'm going to prescribe a short course of antibiotics.
Is that safe, considering my penicillin allergy?
Absolutely.
Thank you for checking.
I've selected an alternative medication specifically because of your allergy.
I appreciate that.
I'd also like you to increase your fluid intake significantly. Try to drink water regularly throughout the day.
Not just coffee?
Especially not just coffee. You should also focus on getting at least 7 to 8 hours of sleep each night.
I'll make that a priority.
Excellent.
How soon should I start feeling better?
Most patients notice improvement within 3 to 5 days. If your symptoms worsen, however, I want you to contact us immediately.
I will.
Otherwise, we'll schedule a follow-up appointment in 2 weeks.
Sounds good. Thank you again, Doctor.